prostate cancer had developed into stage 4. He died, okay? Literally fell through the cracks because it didn't make it into the medical record. They didn't have a system there for someone to say, gee, where's Mr. Jones's PSA test? That should have been back here last Tuesday. Okay, so you need to make sure there's a process. And if that's your responsibility, whose ever responsibility, you need to make sure that things get back into the medical record where they belong, okay? Patient education and discharge instructions, you need to make sure that that's covered with diagnosis and procedures and a return demonstration by the family or the patient of your information. 2 stories, family stories. They would kill me if they knew that I was telling these stories. A few years ago, I went with my sister to an area hospital for a breast biopsy, outpatient procedure. When she was all done, I went into the room and sat with her while she had, just all the anesthesia was washing out of her. And she was ready to go home, and the nurse came in and said, now, Gail, I need to make sure that you wear a form-fitting brassiere, nice and tight for a few days, keep your dressing dry and intact, don't take any showers, don't do any heavy lifting, yada, 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 yada. Now, tell me what I just said. And I went, yes. He was asking her to regurgitate to him what her level of understanding was. Did she really know what she wasn't supposed to do? Okay? Good discharge instructions. The other story is my father. When he was in his 80s, he went and had his one and only colonoscopy. He said, I'll never do that again. Okay? I was traveling on business that day, so I couldn't take him to the hospital. I couldn't pick him up and bring him home. So he had another elderly friend do it for him. Okay? Procedure's all done. Everything's fine. He's going home. They're driving through Brunswick, and he says to his friend, I need some groceries. Let's stop at Price Chopper. So they pulled into Price Chopper. Now 2 elderly people are pushing their carts up and down Price Chopper. One of them just had a colonoscopy. Okay? And my father had a little event, which gives a whole new meaning to the term clean up in aisle 5. Okay? All right? He was devastated, embarrassed, humiliated. He got home. That night I went to see him, and he told me what horrible thing happened to him. And I said, well, Dad, what did they tell you? Well, they told me to go home and rest. And I said, well, why didn't you? Well, I was feeling pretty good. And I said, yeah, I know you were. You had Valium on board and Versed, and you were 4 gins down the road, okay? My sister understood her directions, didn't she? Did my father? So what was their level of understanding? And just giving him or giving her or any of your patients the pamphlet that says this is what you should do after the procedure, make sure they tell you that they understand, okay? Because we have had cases where patients with chest pain left an ER diagnosed with GERD, okay, heartburn. They go home, they start stacking firewood, they have an MI and die. We have had that case, okay? Who did they go after? This is the interactive portion of today's program. Who they go? They went after the facility. Why? Because he didn't understand that he shouldn't go home and lift firewood. Now, you might say, well, that was his fault, right? But who is E. Stewart Jones going to go after? The widow? Who's his client? Or is he going to go after the facility? Okay? So make sure your patients understand what they're supposed to do when they walk out those double glass doors down the hall. Okay? They're supposed to go home and rest after the procedure? Or whatever, okay? Whatever it might be, whatever you're doing. Remember that health teaching reflects good care. If they like you, they are less apt to go after you, okay? Though those discharge instructions, that's a licensed professional's responsibility, okay? It has to be a licensed person doing that. It can be either paper or electronic, but make sure that we have something in the record, okay? A copy of it, something like that. It should include anything that was done verbally or pre-printed, and the understanding and comprehension by the patient or family, okay? I know this is a little bit of work, but that little bit of work might keep the practice out of the courtroom, okay? And I don't think anybody in this room wants to see the practice go to court, okay? I don't think anybody wants to see one of the docs get sued, okay? Ensure that a file's kept of all past versions. In other words, I make sure I tell Deb and I tell Julie that here in 2016, you want to make sure that we have a copy of the 2016 version of the pre-printed instructions, because if the lawsuit's in 2020, 4 years from now, do you want to be held to the 2020 standards or to the 2016 standards? Obviously, the 2016, okay? So we want to make sure we keep copies, all right? I don't know why that first thing is not dark enough. I'll have to fix that. Identify the patient on every slip of paper that is scanned into the EHR. Okay, so if anything comes back from an outside concern, another doctor's office, a laboratory, a hospital, make sure there is some identifier on that before you scan it into the record. Is that what you guys do? Make sure there's some sort of scan. Use correct spelling and grammar. Now you might think this is a little funny, okay? But we had a case where a registered professional nurse wrote a very good note. Patient complains of sore muscles. Very good note. She spelled muscles, M-U, you gotta look at the screen, M-U-S-S-E-L-S. How did that go over in the courtroom? That a registered professional nurse can spell a basic anatomical structure, excuse me. Okay?
She was hungry.
She was hungry. Do you think that discredited that nurse in front of the jury? Sure it did. Sure it did. How good a nurse could she be? She can't even spell her job, excuse me. All right. Use caution with the autocorrect feature. This morning I found out that you don't have the autocorrect feature in your chart, so that's a good thing. Okay, but you all know what that is? When you're texting and you type in one word and another word pops up, that's autocorrect. The machine, the machine thinks that you're typing something else. Don't use text speak. You guys know what text speak is? Okay. Who knows what that says? You get a drink of water now? It scares me that you know what that read. We'll check on patient later. It scares me that you know. Do not use text speak. Okay? What does that tell the jury? That you're lazy? Okay? That you don't care? Or whatever. Let me go back to that. I don't know why that happened. Okay. If that phrase will help Stuart Jones with his case, who's he going to try to get on the jury?
The one who wrote that.
No. Someone who doesn't like computers, someone who doesn't have computers, an 82-year-old that doesn't understand smartphones, and don't do that text speak thing to me. He will try to put on the jury people that'll be negatively impressed by that.